Good morning, and welcome back to Good Samaritan Facebook Live. My name is Dr. Scott Stine. I'm a family physician here in Vincennes, Indiana, and Chief Medical Officer of Good Samaritan Physician Network. Joined today again by Adam Thacker, who's our Chief Operating Officer of Good Samaritan Hospital. We're going to give you an update on kind of where our community is, hospital, state, and the nation as far as COVID-19 response. And a lot has changed over the course of the past week or so for the better in terms of where we are heading in our current state. So we'll talk about a number of things today. We're going to lead off talking a little bit about the number of cases that we have locally. We'll move into talking a bit about testing and some of the changes that have happened over the course of the past week or so. And then also talk a little bit about what the governor's announcement and address was on Friday, which included a very detailed plan as to where we go from here. We may touch a little bit on the president's address also from yesterday evening. And then, of course, we'll be taking your questions as we round things out. So to lead off with a little bit, to talk a bit about where we are in terms of cases, we're excited to report that over the course of the past 10 to 12 days, we've had no new positive cases within our county. One of the measures that we'll talk a little bit about when we talk about Back on Track Indiana is the number of new cases that have come up and the spacing and the timing in between those two cases. When we go back over the course of the past couple of weeks or so, we were seeing about one new case every 3 days or so. And over the course of the past 10 to 12 days, that has dropped to the point where we've had no new cases reported within our county, which is very exciting, as we will kind of talk a little bit about how we use those measures to determine what the penetrance is within our community, how many cases that we have within the state, and then how we respond by opening things back up. The numbers are looking very favorable in that manner. The total number of tests that we have done has increased tremendously. So if we look over the course of the past couple of weeks or so, the number of available tests has increased, therefore the number of testing has increased. So when we look at the number of positive cases that we have, the important thing to realize is that we've had no new cases despite the fact that testing has escalated. The number of patients that we've had in the hospital with the illness has diminished as well. The number of critically ill patients has diminished as well. And so those are all factors that we're using as we move forward in opening things up and determining that we have the capacity to take care of those patients. So as we talk about testing, Adam, can you kind of go over where we were and interestingly all that's changed in the course of the past week or so?
Sure. Well, a lot of exciting developments, and as Dr. Stine mentioned, our testing has continued. Internally, from the beginning of our COVID response, testing was taking a number of days and sometimes even weeks, and we were able to trim that down to a 48-hour turnaround time, and now we even have in-house testing that we can do in a matter of under an hour for our inpatients where quick decisions need to be made regarding their hospitalization. Now, as part of the governor's plan, a robust testing and tracing program across the state was an important element. That was rolled out actually by President Trump as part of the blueprint that each state had to respond to. So we learned last week that OptumServe will be setting up a testing site here in Vincennes. It's at the National Guard Armory. It is planned to be up and running as of Wednesday of this week, and they will be performing testing of the same type of testing that we have performed here. So the nasopharyngeal swab testing for active presence of the virus. So not to be confused with antibody testing. This is testing for symptomatic patients that have the virus. And you go through an online portal that you're able to access the testing site, fill out a screening tool, and then you get an appointment to go for testing. So as that continues to evolve, when it opens Wednesday and moving forward, that will expand our testing capabilities. Good Samaritan will continue to test symptomatic patients that are seen either at a respiratory clinic or come through our emergency department requiring hospitalization. Or after hours, that testing site's not available, but we're adding another entry point for access that patients will be able to be tested. The second piece of that is if somebody tests positive, contact tracing that you've heard us talk about a number of times. As that goes through OptumServe, that will be centralized to the Indiana State Department of Health, and anybody that tests positive, they will reach out, they will go through the process of identifying who you may have been in contact with and any known risk, the quarantine process, all of that remains the same, and we're working in conjunction with the state to make sure that that is a collaborative effort.
There's some other testing that has gone also that some people in the community have been contacted about. Can you speak a little bit about that? Because I think people are a little confused as to the two different modalities of testing.
Right.
One testing being for people who are symptomatic, which we have been doing all along, and then the other testing that has come up recently.
Sure. So along with this, the IU Fairbanks School of Public Health has also partnered with the state to roll out an asymptomatic testing of patients. So those patients are randomly, or those individuals are randomly selected across the state. The goal is to test 20,000 Hoosiers over the course of the next year. So about 5,000 individuals are being tested now, another 5,000 in May, another 5,000 in October, and then another 5,000 next April. That is to really get an idea of the asymptomatic presence of the virus and help with some decision making. That is the same type of swab, but that also includes a finger stick and blood to be taken, and they are going to test for antibodies as well. So that's a controlled study, that random selection versus the OptumServe testing, and the testing that Good Samaritan is doing is symptomatic patients looking for presence of the virus right now and trying to risk any potential, or trying to decrease any risk of potential spread across our community, which, as you heard from Dr. Stine, coming up on 2 weeks without a positive case. So everybody's done an excellent job of managing their own health and staying on top of their own symptoms and following the guidelines that have been laid out, and it's really made an impact here that's going to allow us to reopen along the governor's plan, and as we're hearing, maybe even some regions being able to move at a quicker pace or slower pace depending on transmission of the virus within our districts.
And I think it's important when you talk about that population-based study, that addresses some of the questions that some of our viewers have had with regards to when we started this 6 or so weeks ago. We talked a lot about what a large percentage of patients who acquired this didn't have any symptoms at all, and potentially were walking around and had the illness, and we didn't know about them. And so a lot of that has come from speculation and from studies overseas that have reported what number of patients, especially younger, healthier patients, potentially had the illness but never reported symptoms. And so as we move forward, as Adam was talking about, they're going to roll this over multiple months, over a long period of time, and that sampling of patients is basically going to be used to look at what percentage of patients have the illness but don't have any symptoms, and also potentially have already had the illness and developed antibodies to it. And so it's going to answer a lot of the questions that all of us have had over the course of the past few weeks or so, as far as what good is antibody testing going to do? How is this going to help us when we enter into the fall? How are we going to use this data to determine whether we're opening too quickly or too slowly, or manage a lot of those things? And I think as we heard the governor's address last Friday and got basically introduced into the Back on Track system, it was encouraging to see that this is a very extensive plan. I think it's been very well thought out, and probably the most encouraging thing to me is the fact that this has been tailored to look at us as not just as an entire state, but as regions. And I think as we move forward, it's important for all of us to consider that Vincennes is not Terre Haute, and Vincennes is not Indianapolis, and Vincennes is not New York or Chicago. And so as we move into this plan, the things that we'll talk about in terms of contact tracing that you mentioned, and also the testing that's going to be performed, we've had a very, very, very low incidence of disease in our community. And as we open things up, that opens our community up as well. So we have to realize that we will be traveling out and people will be traveling back in. And so Dr. Stewart has done a fantastic job locally of doing a wonderful job tracking our patients, keeping all of us locked down, and we've had very few cases overall. And as we open up, it's important to realize that that's some of the things that we'll be looking at. So one of the first things as far as the blueprint and the Back on Track program was seeing decreased hospitalizations. I think you and I look multiple times every day to see if something has changed on the website. I think many of you get on indiana.gov to look at the coronavirus website to see what those numbers are every day. And it's important to note that peak has occurred over the course of the past several days, and we've seen fairly consistency in the reduction of those total number of cases, and also probably more importantly, the total number of deaths and hospitalizations. And so one of the first parts of the plan was to look to see that hospitalizations decreased, which they have.
Right.
And I think the second part is what you addressed in terms of where we go with the testing and making sure that testing is more available. And so those two things really we've been doing very well on over the course of the past couple weeks or so, but I think from a state standpoint, that trigger now has been pulled to say, hey, we're seeing this statewide and now things are more favorable.
Right. And across the state, the goal is to test 100,000 Hoosiers a week. And so Vincennes having one of the first 20 sites, we feel really confident that we're going to have good information coming out of that to make decisions. So along with the testing, and as we reopen, the word resurgence usually follows the reopening. What's that going to look like, and how's that going to impact hospitals? And I had an article shared with me over the weekend that I read about the potential impact on rural areas, especially because of the resource availability. I think a couple of things. One, I feel confident in Good Samaritan is not your typical rural hospital that looks at. Our resources are certainly at a high level, and we're prepared for potential resurgence. But not knowing the magnitude of that, we have to be prepared for everything. So our surge capacity protocols and having the appropriate PPE, having the appropriate staff trained to be able to change and pivot to if we need to address a surge. Those things fall into, we're starting to open up diagnostic and screening and test as well as surgeries. So if we were to see a surge, what's our plan for that, such as shutting those back down to respond to COVID? All of those things are in place. You never know the magnitude of what the impact of that will be, but we do have those aspects in place and are ready to respond should there be a resurgence. And I think that it's just important for everybody to know as things reopen, there likely will be. Now, we expect those to be kind of small pockets, not large, overwhelming surges such as happened in the early stages. And I know, as we've said before, Good Samaritan, along with, I would say, every hospital in the country, I hope, is immensely more prepared today on May 4th than we were on March 10th when we started planning for this. We have processes in place. We have physician leaders that are ready to address many of the needs related to COVID. The information sharing has been tremendous across healthcare, and we're just more prepared in general to address any types of those resurgence. So it's certainly common and really even expected as we reopen that there's some concern about what that'll look like. But as the healthcare provider for the region, we feel confident in being able to meet the needs of our communities.
I think that was an interesting thing yesterday with the President's address, is that one of the common threads that seemed to come up was there's a population out there that has been ready to go back to work and ready to get back out and re-engage, and thinks that this response has been too much. And then there's a population that thinks that we're pulling the trigger too quickly and we're re-entering normal society a little bit too fast. And I think the thing to keep in mind is that all of this that we are doing, everything that we look at on a daily basis, we are trying to do based on good, solid data. We're not guessing at things. The leaders that are helping us from a state level and also from a national level are trying to look at this as closely as they can from good, solid data. And that's what helps us to feel good about this, because as we move through this, if we see resurgence, if we see an increase in numbers, that quick communication that has really developed over the course of the past 6 weeks is what's going to help us to respond quicker to that.
Right. And I would applaud Governor Holcomb because I will admit I was somewhat skeptical of what the plan would be and how slow the phases would be. But it's a pretty aggressive plan when you compare it to other states. And I would also applaud him that he also made the comment that is very true. If you as a business owner or leader or are in the high risk category are not ready to go back, don't. There is no forcing of the hand of anybody in this, and so I think it's a well laid out plan to move in that direction.
One of the things that's also part of the plan that you had mentioned that maybe people don't fully understand is contact tracing, and that's been something that has been done really from the onset of this. It's been done locally, specifically through our health department, through Dr. Stewart, and that's going to continue on. Now, it's been relatively easy for us thus far because it's been a very limited number of patients that have come through. Right. But even as testing has expanded and the number of patients that are going to be tested expanded, that contact tracing is going to continue, and that's important to realize that we will know each and every patient, follow each and every patient and their contacts to make sure that we know if there's a new pocket, as you mentioned, or a new peak in the curve that comes up, you know exactly how many of those patients there are.
Right. So along with the rapid expansion of testing, you have to have the contact tracing. Those are two key elements coming from a global standpoint that said you need to have these in place. And so with robust testing, when you have a positive case, the contact tracing is an in-depth interview of that individual to know everybody that they were in close contact with at less than 6 feet and for potentially a prolonged period of time. Those two elements are what lead to transmission of COVID-19, as we know. And so the quarantine, self-isolation approaches go into effect. Dr. Stewart's group has done a phenomenal job. If there are positive cases in the county, and there will be, and moving forward as the state testing evolves, Dr. Stewart's group will still be contacted. They're still in the loop on that. They'll still help with some of the boots on the ground contact tracing to some degree, but it will also be somewhat automated through the state. So we're hopeful that that'll be a well-coordinated plan, and I'm sure that it will continue to evolve as it goes on. As Dr. Stine mentioned, one benefit that we have had is that the number of cases we've seen has been very low, but also the occurrence of how many have happened at one time has been very low. On most occasions, it's just been one case at a time. A couple where it's been more than one, but very few. So as that happens, it allows us to respond. This pandemic is one that, even though we talk about the exponential growth, in our region the growth has been at a pace that we've been able to have meetings, pull the leaders together, have the discussions, and respond effectively. It's not the same type of response as an earthquake where you have mass casualties, thousands of individuals, and you have to respond to this overwhelming need, but we've been able to do it systematically.
I think one of the things, as all of our community leaders look at the Back on Track Indiana plan, one of the things that comes up frequently is the question of supplies. So as you and I know, over the course of the past 6 weeks, we have really scrambled to make sure that we had adequate rooms available and critical care facilities and staff and PPE and all those types of things. And now that things are opening back up, I think a lot of our community leaders and business owners and so forth are going to be coming up with their own plans as to how to roll that out. And I think perhaps one of the next challenges that we're going to see is making sure that everyone has adequate PPE within the community, and then what that is. One of the things that was really a hot button topic early on was N95 masks. We even had people ask about N100 masks, right, and the all elusive N110 mask, which I don't think has been invented yet. But the key thing here is that it's still recommended that people wear PPE when they're out in public, especially when they can't maintain that social distancing. As businesses open up and they look at some of the parts of Governor Holcomb's plan, which is 50% capacity or 25% capacity, these types of numbers are what are thrown out. It's important to realize that that's what we've been doing all along. But we're obviously going to be opening up a lot of these new businesses. As of today, a number of businesses will be opening up to some increased capacity. And so we still need to make sure that we are all maintaining that social distancing as best we can. Our local businesses and restaurants and apparel stores and retail and places like that are again going to try to put their own measures in place to maintain that. But we personally need to be doing that as well and continue to wear masks out in the community, and especially when social distancing is not available. That's what we should all be doing individually.
Right, and comment on the masking is the universal masking. A cloth mask meets that need for out in the community and for business owners as you're rolling that out. You do not need the N95 mask. Those are medical grade. There are some that are construction grade, but from a medical standpoint, we're using those when there are aerosolizing procedures or increased risk beyond anything that would be seen in a normal retail business or business industry that is occurring here in Vincennes. And from a supply standpoint, we've done very well. Happy to say, and I mentioned this on an interview the other day, at no point has Good Samaritan ran out of any critical supply to where we had to make some difficult decisions that unfortunately some hotspots across our country had to, where healthcare workers were provided inadequate PPE, personal protective equipment, simply because of availability, and they got on the front lines and they took care of patients and they did what was necessary. But at Good Samaritan, we have had the N95 masks, the face shields, the gowns, the gloves, everything that we have needed to have to take care of patients. And so as things start to reopen, we're confident in our procurement lines to be able to keep that open. But it also takes everybody. You still have an impact on this, just like social distancing, in that if individuals are going out and buying medical grade equipment that is unnecessary, that can impact our own supply chains in a negative way.
I think we were very close to critical on coffee during the first 2 weeks. Is that correct?
Caffeine was a must.
That has come back though. So backontrackindiana.gov. I would direct anybody, especially local business individuals, to look at this website. It is very detailed. It is very specific in addressing the capacity that you should be limiting to as far as exposure at work, and then all the things that we're talking about as far as what we will do to ramp up or de-escalate over the course of the next few weeks or so. So backontrackindiana.gov. It's a very good website. It's laid out fairly extremely clearly. And you want to talk a little bit about some of the dates that are coming up? Obviously, today is a big day for one.
Yeah, today was a big day. So we are in stage 2, which if you have looked at it, you might have seen some counties are not. That had been postponed based off of the number of cases. And so as Dr. Stine mentioned, that was one piece that we were very happy with, that it gives some regional credit to where cases are. Keep in mind that can shift. So as we look forward for May 4th, May 8th, some of the church services, religious services start to open. One thing to keep in mind is that individuals over the age of 65, individuals that are considered high risk, are still very much requested to follow the strictest of social distancing and even shelter in place where possible, and certainly look at how to do that, because you're at risk for the disease affecting you in a more severe way. As we continue to move forward, May 24th is another big date where there's additional opening of gyms and that type of thing, and start to really feel more of a new normal. 50% seating capacity within restaurants, and starting to move in that direction. One thing that I will mention is that these 5 stages are set out to move through July 4th, but it is predicated on data. So hospitalization, PPE, resurgence of COVID within areas. So those dates are not set in stone. So while we have a plan for what each of those look like, and healthcare is already at stage 1 was reopening and reopening towards full services, but other businesses not only have a plan for what your date indicates for your business, but also have a plan on if that date moves and what that needs to look like. But as we move forward, that May 24th is a big date, and then June 14th is a milestone for stage 4 and increasing of capacity, and social gathering numbers start to go up, and then July 4th is kind of the end that we're working towards from the stage 5 standpoint, where we move all the way towards even universal masking being a optional aspect. But again, those will continue to evolve. I think it's safe to say that stage 5 laid out on July 4th right now will go through some revisions and look a little bit differently when we get to July 4th. And quite honestly, May 24th will probably look a little bit differently when we get to there. There is opportunity regionally that some of those dates may escalate based off of if we continue to see no cases or low transmission of cases, but there's also opportunity that may back up and move at a slower pace. It's all about safety and not overwhelming the healthcare capacity so that we can take care of individuals.
And much of what we've done and the planning that we've gone through over the course of the past several weeks has been focused on that from your healthcare delivery needs. We've looked at that in terms of the most essential things over the course of the past month and a half, and then over the past week or so opening up to more elective procedures that could be started, and then continuing to progress and open that up for all procedures. Mammography and screening mammograms are opening back up as well this week. It's important to realize that one of the side effects of locking everybody down and keeping everybody at home is we've had a number of patients that have remained home too long, and they have gotten ill as a result of other problems unrelated to COVID-19. So it's important that everybody realizes that from a primary care standpoint, from a specialty standpoint, from a surgical standpoint, those services are available. And we want people to make sure that they engage with their providers to make sure that they realize that we're available by telephone, we're available by telehealth like never before, and that we have appointments available every day, and we are proceeding with that. And we will continue to do that, just as Adam said, in a stepwise process where we look literally every day at the numbers that we have, cases that we're performing, and our hospital capacity and our critical care capacity, what resources that we have to make sure that we're doing that in a safe manner to make sure that our patients are safe, and then also our employees are safe as well.
Right. And last week we were averaging almost 500 virtual cases across our Samaritan Center Behavioral Health and our Good Samaritan Physician Network medical group, and that certainly is a great way to access care. It's not a one-size-fits-all, so there are certain things that cannot be accomplished virtually at this point. It continues to evolve. Our emergency department is ready to see individuals that come in for urgent needs. Our convenient care approach, I think the message here is don't put off health care because of a fear of coronavirus when we know in our community the transmission is very low, and quite honestly the impact of putting off those needed medical needs is going to be worse than the risk of contracting the coronavirus. Our healthcare system is quite possibly the safest place in the community that you could go. I mean, we've been doing infection prevention protocols longer than anybody, and to a higher degree just based off of the medical nature of it than any other industry. So it certainly is a safe environment to come to and seek care.
So we'll open things up to questions. I know there were a few questions that were left over from last week that we addressed a little bit online, but one of them was, why do we have so many people coming into our hospital from the surrounding communities? And as Adam had alluded to, it's important to realize that we're a regional medical center here, and we have 8 to 10 counties surrounding us that their patients filter into us, and some smaller hospitals that patients filter into us as well. And at no point in time has that service line put any of our local patients at risk. It's important to realize that has always been maintained, and that we've only touched on just a fraction of the capacity that we had for these patients. And so it's important to realize that at no point in time have we had any issues managing our own local patients, and we're happy to bring those patients in from our surrounding communities where they're comfortable to be taken care of here. Tiffany, you have some questions for us from our local folks?
Yeah, one question I have is, you're curious about the new rate of infection. I think this is last week or maybe the week before, it was around 6, and since we've stayed at 20, what does that mean if we've done more testing?
So it means the presence of the virus has not been detected at a high rate here in Knox County. So not to get too technical in the data, although I have said I'm self-proclaimed data geek, but we look at what's called the positivity rate. That means out of all the individuals that we're testing, how many people are actually testing positive. The state had been running 18+%. We have been running in the 7% as of last week. I looked at the data this morning, and we're at 6.1%. So that means 6% of the patients that we test are actually testing positive for coronavirus. That's a really good number, because you can find, a quick Google of epidemiology will tell you that less than 10% is a safe number to start reopening things. So we feel really positive about that. And an important piece of that is that our testing and the quantity has remained steady. So you can decrease your positivity rate by not testing as many folks, but we have been testing symptomatic individuals only, and we're not detecting the illness at a high rate. So that really ties into that positive rate. It also ties into what's called the doubling factor. So how fast are the number of cases you have are doubling. So early on, healthcare systems were getting overwhelmed because cases were doubling faster than they could respond. Our cases are actually doubling at a number of days, more than 2 months before it would take to go from 20 to 40 cases. Actually, patients are recovering faster than patients are getting sick. Of the 20 patients, 17 are recovered and have been released out of quarantine. So there's only actually 3 active cases in Knox County right now that we're managing that would still be considered a high-risk transmission of the individuals we know about.
And those patients are well through their illness and basically just enduring their last portions of their quarantine.
Right.
And it's also important to realize that during the highest time of positivity, that we were barely getting a patient every few days or so, as far as that peak is concerned. And really, we have to give a lot of that credit to our population, our patients, our health department, for maintaining that social distancing, that we never got a high rate going. And so that's important that we've been through that and now continue to look at that number.
When do you see hospital rules with visitors changing, especially for the laboring floor? Specific question.
Sure. So those discussions are actually occurring this week. As of right now, we're not relaxing our visitation restrictions, and it won't be for the foreseeable next few weeks, at least as we get to the next stage, probably that May 24th time frame that we're looking at. What that will look like is to be determined, but we do have a team that's looking at it, and certainly we want to be respectful of the family environment with the care being delivered to patients, but the trump card on that is the safety of the healthcare team and the safety of patients and visitors coming into the organization. So decreasing traffic in the hospital, and I'll say unnecessary traffic, but it's not necessarily unnecessary, but non-essential traffic is still a key element as we start to increase some of our capacity within the hospital. So I don't have a definite date for you, but I can tell you that is something that we're mindful of and are looking at how we can make changes, and it will be on more of a floor-by-floor basis. Certainly the labor and delivery area is one that's being talked about, how we can move forward in a strategic way with allowing visitation there.
And then another question is regarding the state testing that was for asymptomatic people. So someone just asked, how would those people be contacted?
Those individuals have already been contacted, and this testing was initially performed out in the Walmart facility. They may have been contacted by mail, I think was the primary means, but there are patients that were also contacted by phone or by text message as well. But the idea behind this, and as this rolls forward, is this is going to be a sampling of the community at large. So people who may have been patients, may have never been patients, may have been in a home with a patient, may be a random individual that has nothing to do with any sick individual. So the idea behind it is we want to know with the general population out there, what portion of those patients have had the illness, currently have the illness, are symptomatic, asymptomatic, and that's why multiple specimens are being taken from those patients. They're going to get a nasal swab, much what we have done, to check to see if they acutely have the illness, and then some of the blood that's going to be drawn will be tested also to look for antibody testing to see if they potentially had the illness over the past several weeks or months and had no symptoms. Right. And so that's the main purpose of that, and it's important to realize that's completely separate from what we're doing, what Optima is doing, to look at acutely ill patients and track those patients. This is something that really we're going to be using that data moving forward when we hit the fall, when we move into this next cold and flu season, to determine what percentage of patients we think potentially have immunity.
And keep in mind, 20,000 Hoosiers over the course of the next year, and the Indiana population somewhere around 6 million. So if you're waiting for your phone call or your postcard, there's going to be very few individuals in our county or region that are tested, but we already do know of a few that did receive a postcard and were requested to test.
Now, are you worried about a second wave that may be worse?
I don't think that we're worried about a second wave that will be worse. I think we all are counting on new positives over the course of the next several weeks. If we look at almost all illnesses similar to this and how they are spread, when things are de-escalated, we almost always anticipate that there's going to be some new patients that will come up and there will be a bit of a resurgence. However, what we have seen from data from other countries and other systems is that second peak is much smaller, that the rate of change frequently comes up and comes down similarly. And so what we have seen was a very slow rise in our peak and then a very slow decline, and the peak wasn't very tall. And so I would anticipate that we would have very similar type things as we move on. The other thing that we have going for us is not only is the number of incidents in our local community small, but if we look statewide, we're not necessarily a hotspot compared with other places around the nation. And I think that's one of the reasons why we have had these two groups, this dichotomy that has occurred of people that say, why have we locked everything down versus why are we opening everything up so soon, is because we really have different setups across the entire country. If you are living in New York or you're living in Chicago or you're in Washington, very different systems and very different number of patients. So one of the things that, again, that I think we've all been very pleased with our state's plan is the fact that it's looking at us individually as regions and looking at our data individually as well. And so I think that makes us all feel better about that.
And you might comment, as we do see a second wave, the percent of those that actually need hospitalization is a very low percentage compared to those that can just recover.
Absolutely. And what we anticipate, there's a lot of discussion as to what will this virus do in the future and what is it going to do over the course of the next several months or so. And the general rule is these viruses tend to mutate and change and become less virulent and less severe, and the spread is less severe. So when people are asking now, what's going to happen this winter, we know from modeling of other illnesses that there's likely to be some resurgence at some point in time, but we don't anticipate it to be like what this this initial infection rate was. The other thing that came up, if you watched the President's address last night, was the potential for a vaccine. And there are lots of companies that are working on the vaccine right now. There was no specific time promised, but a mention of the end of the year, and I think we're all kind of waiting with bated breath as to how that research goes. Adam had mentioned earlier that one of the amazing things about the time that we're living in now is the communication between doctors and hospitals and scientists. And as soon as the gene sequencing was performed overseas for this virus, it was sent out to everybody to start working on vaccines. So that's going to really expedite the development of a vaccine, and so we're all staying tuned for that. And a lot of the studies that are being performed right now on the random population that we spoke of are going to help us to determine who that vaccine would be for when it becomes available.
That's all the questions.
All right. Well, thank you all very much for joining us. We will meet with you again in about a week or so, and I think from Adam and I both, and from everybody at Good Samaritan Hospital, we thank you for all the work that you're doing to help support us, and we look forward to things opening up over the course of the next week, 2 weeks, and then our ultimate Independence Day from coronavirus on July 4th.
That's right. Thank you.